Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. I'm here once again with Dr. Sara Figueiredo. Hello, doctor. How you doing?
Hello, Louise. Thank you so much. I'm doing really well. I'm up here in Canada, seeing some patients and visiting family for the holidays, and happy to be continuing the podcast to our many listeners who are very keen on joining us every week and listening to our weekly podcast. So it's a pleasure to continue them throughout the holidays.
Excellent. Today we have a very interesting topic, which is stem cells for chronic pain. And there is a variety of chronic pains that we have. Just to mention a few, we can say rheumatoid pain. We can also call the neuropathy, tendonitis. Also, if you play any sports like tennis, like elbow pain, your knees, different types of pain that we suffer, right, doctor? And stem cells can help. Is that correct?
That's right. Yes, that's right, Louise. We treat so many different types of chronic pain, and as you mentioned, I'll reiterate a few of them. We have so many patients coming in for with sports injuries, the knees, the shoulders, rotator cuff, and frozen shoulders, and then tendonitis or tennis elbow, ligament and tendon issues, as well as other types of chronic diseases like rheumatoid arthritis, degenerative arthritis, neuropathies, which are like nerve pain, and many different conditions. Disc also, herniated disc and back pain issues. So we treat so many different conditions successfully with stem cells.
So, doctor, how can we treat those conditions with stem cells?
Oh, yes. Okay. So the main approach with the stem cells is local injection. In these cases, when we're dealing with tendons and ligaments and joints, with most of these conditions, we treat them locally. So we do a direct injection in the area that is degenerated or damaged or in the area of pain. And so we do local injections, and then in some cases we do IV deployment of the stem cells also. And the reason for the local injections, and this is done with a local anesthetic also, so there's no pain involved. And the reason why we do this locally is because most of these areas of the body are not very vascular, which means there isn't much of a blood supply in these areas. So putting them intravenously wouldn't help as much as deploying them locally. And so the results are phenomenal in this way because we use the most viable and the highest numbers of stem cells. And the type of stem cells we usually use can be bone marrow or adipose-derived stem cells, as well as endometrial-derived stem cells. For these conditions, endometrial is less used in our clinic. However, bone marrow and adipose-derived work very well for these conditions.
So, doctor, what will be involved in the whole treatment?
Yes, that's a good question, Louise. What we do is our approach is very comprehensive. So we incorporate a pre-treatment protocol, which involves some key dietary changes, lifestyle changes, antioxidants, omega-3s, things like that, as well as once they come to the clinic, we will incorporate a total detox program, our proprietary total detox program, which is an intravenous concoction and cocktail of vitamins and minerals and antioxidants that help to start the detox process, as well as B vitamin shots and suppositories, organic natural suppositories. And this just starts the detoxification process in the liver in order to prepare the body to best receive the stem cells. And then we also follow this up with growth hormone therapy, age appropriate growth hormone therapy, as well as our stem cell enhancement formula, which is a cocktail of herbs and minerals, key herbs and minerals, as well as oxygen therapies. So all of these adjunctive therapies prepare the body to receive the stem cells, as well as if we're using autologous stem cells, which are stem cells from the patient's own body, it prepares the stem cells also for the best possible results. And then these treatments continue for up to 3 months back home. Once the patient returns home, we send them home with these follow-up therapies. And we only need them in Guatemala for treatment at our clinic for 7 to 10 days, depending on what we're treating. So the whole treatment lasts from start to finish about three to 4 months. However, we only have them at the clinic for 7 to 10 days.
So, doctor, after the stem cells are applied, when can we start seeing some results, or when can we see some recovery?
Oh, that's another very good question, Louise. So it takes up to 3 months for the stem cells to take full effect. Okay, and however, we do see reduction in pain within a week or two, and it is not unheard of for pain to completely disappear within a few weeks. However, the stem cells are still working, and we usually see complete pain resolved in 3 months. And our results have been phenomenal, considering the fact that we adjunct it with so many different therapies in order to just get the best possible results with oxygen, providing the tissues with revitalizing oxygen, as well as the growth hormone therapy and the correct nutrients, and also as well as rehab exercises, which are really important in incorporating into the regimen. So we incorporate all of these things and leave no stones unturned for the best possible results. So yes, we have very many happy patients, and happy to provide testimonials on that as well.
Oh, I see. And we can arrange all the travel arrangements for people that are coming outside Guatemala, which is where our clinic is.
That's right. Yes, we provide accommodations, as well as a driver for ease of moving around in the city, getting to appointments, to and from the airport, so on and so forth. And we also help in finding the best plane tickets and at the best prices.
Excellent. Yeah, should I ask you, doctor, if they have to do a follow up visit or not?
Um, um, what? No,
No.
let's not, because let me think. Well, yeah, you can ask me. You can ask me. No worries.
Okay. Uh, so, doctor, should there be like a follow up visit after the first treatment is done?
Yes, Louise, that is okay. Never mind. I'm going to start again. That is another very good question, Louise. We also provide a complementary booster shot of platelet lysate after 6 months, which, if our patients are happy to come back, we will provide a complementary booster shot. It's not necessary, but it's a great way to provide the joints and the damaged area a little bit of a boost, as we call it, of growth factors from the patient's own blood. So that is something that we provide. It's not necessary because of the numbers and the viability of the stem cells we use. Most of our patients are 100% pain-free after one treatment. But that again does depend on the degree of damage, and so on and so forth. But we do provide a follow-up complementary booster shot of growth factors. So yes, just to answer your question.
That is excellent. Okay, so if you want to contact Dr. Sarah Figueroa, the best way to do that will be writing to info at stemcellhealinginstitute.com. And you can also call us in our North American number. And we also have a Guatemalan phone number. Is that right, Doctor?
That's right. They can reach us locally at 5+502-4220-7297. They can reach us from any part of North America at 209-690-7836. They can visit us on Facebook and Instagram, as well as our podcasts, which are also on Spotify and YouTube. And did I miss anything else? Oh, they can also visit us on our website at www.stemcellhealinginstitute.com, as well as stemxcure.com.
Excellent. So now you know how to contact us. Doctor, is there anything else you would like to add to this podcast?
No, I think that's it. It's a pleasure always being with you, Louise, and looking forward to next week.
So you have happy holidays once again.
Thank you. You too.
Okay, you take care.